platform Swiss Liver Patients Association, Swiss HEPA. Today with the interview by Dr. Susana Gomes Rodrigues, consultant hepatology at the Inselspital in Bern. Welcome, Dr. Susana Gomes Rodrigues.
Thank you.
Today we talk about the topic alcohol and liver. My first question is, what is the liver for?
Well, first, thank you for the invitation. I'm happy to be here. The liver has, one would say, we like to say hepatologists, over 500 functions. What it's most known for is breakdown of toxic materials, such as alcohol, or for example, medication or drugs. And one of its other very important functions is building fat, protein, and sugar. These are the major functions, but there are many functions associated with other things like.
How does alcohol affect the liver?
Well, that also depends, of course, on the quantity. So if one drinks a moderate amount of alcohol, that means in a woman less than 20 grams, or for example, less than 2 glasses of wine, or for a man less than 30 grams per day, or people, of course, who just drink very occasionally, the risk is low or practically none that the person could develop liver problems. But when it crosses this border into something we call alcohol misuse or over alcohol consume, in this case, in most cases, early stages show just signs of liver fat, and then later on can show signs of liver inflammation. And further, unfortunately, what we try to avoid, but can happen, is the development of liver scarring or liver fibrosis. And if alcohol consumption is maintained in time over alcohol consumption, then unfortunately patients can develop cirrhosis. And cirrhosis is, of course, a large amount of scarring the liver in the form of nodules.
What are the symptoms of alcoholic liver damage?
If we're looking specifically at alcohol liver damage, there are no specific symptoms. There are, of course, specific symptoms to alcohol dependency, but when we look at the liver side, it's pretty much comparable with any other advanced liver disease. Symptoms only develop in alcohol-related liver disease in two cases. One, if there's an alcoholic hepatitis, which is a very, very large inflammation in the liver, which can lead to patients developing jaundice or yellowed skin, and also water in the belly, which is called ascites. One of the complications of developing a liver cirrhosis, be it for alcohol or for other causes, is the development of a complication called portal hypertension, that is increased blood in the portal vein. The complications associated to this are increased water in the belly, which is called ascites. Other ones are, for example, bleeding, and another one is, for example, confusion. Of course, patients with liver cirrhosis also have increased risks for example, liver cancer and also for infection, but there is no real specific symptom for alcohol associated liver disease.
How can alcoholic liver disease be diagnosed?
Well, the first step, of course, is an anamnesis. When we first take a clinical history with the patient, when they first come to our outpatient clinic, it's one of my first questions is, how much do you drink a day? And that's not always an easy question. And as you know, in our society, it's a taboo topic. I wouldn't say amongst everyone, but I think amongst many people, they feel ashamed to talk about it. And they feel sometimes perhaps that by my asking that I'm prying into their personal life. So in order to make it okay with them, what I generally do is I say, listen, this is something that I ask every single person who first passes by these doors and sits next to me for a consultation. One of the first things I ask is how much they drink. No matter who they are, where they come from, doesn't matter. I ask that, and it's absolutely without judgment. I never judge patients for anything, would never. And I make it clear to them that it's just something I need to know. And of course I need to know that, because if I don't know how much they drink, I can never help them. I can never identify if there's a problem. So the first way to diagnose it is, of course, asking how much they drink. And if it's overconsumption, as we said before, then that makes me think that it could be an alcohol-associated disease. Then, of course, we have all the other tests that we use for liver disease, for example, the liver transaminases, ALT, AST, usually in alcohol-associated liver disease, AST is increased in comparison with ALT, and gamma GT is also very high generally. There are things we can see in the hemogram, for example, macrocytosis, that's the red cells are enlarged. So there are different tests we can do. There are two specific ones, which are CET, which is positive by increased over alcohol consumption, or urinary ETG, which also tests a byproduct of ethanol, which comes from alcohol. And so we can test if there is active alcohol consumption.
That's very helpful. And so we have to know there is no taboo topic.
Absolutely not. And it is very important to me, one, that the patients know that I generally do not judge anyone who comes to the outpatient clinic, and that they feel free to open up to me. And I usually tell them that what stays between those walls stays between those walls.
That means actually it's very important between the patient and a doctor to trust each other.
Yeah, I believe that's the case in any disease. Yeah, without trust, both ways. Without trust, I think particularly if the patient doesn't trust us, it's difficult then to build a relationship with the patient and in the end for the patient to improve.
So actually we have to encourage every patient to have power and be trustful and go with your illness or with your disease. As a patient, I have to help myself.
Absolutely. We, at least in our team in the Inselspital, we're very pro empowering our patients. For me, it is very important that I spend time during the consultation, that I have time to explain to the patient what is a liver disease, what is a fibroscan, what is a cirrhosis, what are the complications, what is drinking too much for a man or a woman. Things like this are very important that I feel that the patient understands before leaving, because you can only patients can only be empowered with knowledge.
That's true. The knowledge is the most important, so you can ask the right questions. And that's help you to know a patient is eager to know something.
Yeah, I adore that. I love when patients ask me questions and are curious about their disease.
Yeah.
That's a very good sign that they're interested also in helping themselves.
Yeah. My next question is, can alcohol liver damage regress?
Fortunately, it can, and in most cases it can. The question is in what stage we diagnose it. So when the patient arrives and is in an early stage, that means they just have, for example, liver fat. In many cases, 6 months or even less of alcohol abstinence, liver damage, which is in this case liver fat, can completely disappear. Unfortunately, when we reach stages of more advanced cirrhosis, those who have developed those complications from portal hypertension, that means people who have bled, something called varices in the esophagus, or develop water in the belly, called ascites, definitely alcohol abstinence is 100% necessary. And this is what I tell our patients, not one drop. When you have a liver cirrhosis, it is essential not to drink, because if you continue drinking, the risk of developing these complications, worsening them, or developing liver cancer is increased. And it's important that they understand the risk that they're taking, of course. And when these cases occur, when we have patients, unfortunately, come very late in the disease with already severe complications, what I can tell you is that when they stop drinking, and those who do stop drinking clearly improve compared to those who do not. Mm-hmm. Whether or not they go completely to normality, no, they don't. But certainly the disease can recompensate itself into an earlier stage of cirrhosis.
So is there any information material on alcohol and liver to help the patient to more know about that?
So we in the Inselspital developed a brochure for liver cirrhosis, and this of course applies to patients who have alcoholic liver cirrhosis. And now we're working on one specifically for alcohol-related liver disease, where we highlight not only the signs associated with liver disease, but also highlight the necessity for alcohol abstinence And we include some centers in Switzerland that are renowned to help with alcohol dependency.
So we will put this brochure also on our homepage, how soon is able to.
Yeah.
My last question is, as a specialist, what do you recommend for patients with alcohol and liver problems?
The first thing I always would say is that, number one, you're not alone and that there is help out there. So we are not generally, as the specialists of the liver, we're not generally on the front line or the first line. Generally, this is either their family doctor or their, for example, psychologist. And so we are a bit dependent on referral from these colleagues. So I would say, doesn't matter who it is, be it your family doctor, be it a hepatologist, be it your psychologist. If you're not feeling well and if you recognize that you have a problem with alcohol, please seek help. Because I can tell you that it is not a road that is to be traveled alone. And there are wonderful specialists out there that are there to help you.
Like together we are strong.
Absolutely.
Yeah. So many thanks to Dr. Gomes Rodrigues for the understandable and helpful interview, which is an additional important source of information for the patients. Thank you very much.
Thank you very much. It was a pleasure.